welcome back.
Thank you.
How are
Thank
you?
you. Oh yeah, I'm good.
You all right?
Good. Yeah, yes.
Yeah.
Except for Saturday, or this Sunday that I was miserable. You were happy. You were happy at my expense.
Guys, let me tell them the story. Let me tell them the story.
Oh, Kwame, it's okay. Let's do the show. Let's do that. You later will tell us. Kwame, yeah. You smooth.
I want to tell them the story of how you were jubilating even before the die is cast.
Oh, Charlie.
Okay. Well, folks, just so you know, Doc is a sinner. He's a Yannick Sinner fan. And so I'm sure you understand why he was jubilating on Sunday until Team Alcaraz showed him where power lies.
Premature
ejaculation. That should be our next topic. You have experience in that.
Right.
So last week we started a conversation about prostatitis. And a lot of very good info about it. Today we continue with the sequel.
Right. So Kwame, as part of Men's Month, we are talking about the prostate. Taking the opportunity next week Sunday, coming Sunday is Father's Day. Into that, Kwame, today is BC.
Yes, little ones have started their exam today.
Exactly. So let me take this opportunity to wish two special people all the best of luck. The first is Alison Yaira Lawson Anakwa. She's the head prefect, Nana Nkobia Techiwa School in Mampong, Equiapim. And then second one is Percival Akowa Riafe of VRA school in Abuadze Takrade. And then to all the students at our heritage school at Maijo in the Adenta municipality, I wish them all the best for their exams. Right. So Kwame, the prostate is a very special organ, and I believe last week we learned some biology and we got to know a little bit about its anatomy and its location. Just by way of recap, let me say that the prostate is men's only organ, and it is located in very close proximity with the bladder, the urinary bladder, and therefore most of the symptoms that people can relate to are related to urine flow, and that is why that connection always is there. Today we want to look at the most common medical condition that affects the prostate: benign prostatic hyperplasia. I know it's getting a bit technical or a mouthful, so we call it BPH.
Oh, thank God.
BPH.
Yeah.
Right. So I think most people would have heard about it. And why it's important we talk about this and distinguish it from another form of enlargement of or another condition that leads to enlargement of the prostate, because we tend to rope them together as one entity. So the prostate can become big because of two main conditions. One, you have cancer of the prostate, and then you also have this benign prostatic hyperplasia, and they are totally different entities. So most of the time people think, oh, I have a prostate enlargement, I took some medication and it was fine, but they are at the pathological level, they are totally different entities. So the first part of the name, benign, in simple terms, something that won't kill you.
Okay.
If I want to simplify it, something that doesn't kill you. It doesn't mean that it won't bother you. It can't bother you. And we'll get to know more about it in a bit. But it really doesn't kill you compared with the other thing that gives you, condition that gives you an enlargement of the prostate, which is prostate cancer, which can kill you if you don't detect it early enough and we don't take very aggressive measures. So the third part of the name, hyperplasia, I think the second part speaks for itself, prostate. But the third part of the name, hyperplasia, refers to enlargement of any organ caused by an increase in the number of cells within it.
Okay.
So let's say the prostate has maybe 1,000 cells. All right, and that gives it its standard size. Anytime you increase that number through cell proliferation, and you go to 5,000 cells, automatically the size of the organ increases. And that is what we would term hyperplasia, an increase in the number of cells leading to an increase in the size of the organ. Right. Technically, there are 3 types of this BPH. You have one that we determine at the microscopic level. So we'll take a sample of the prostate and then you examine it under the microscope and you find certain features and then you draw a conclusion. So we'll call this microscopic. We also have what we call macroscopic, meaning the doctor can pick it up or your healthcare professional can pick it up through clinical examination. We'll talk a bit more about it. But you'd realize that this doesn't really bother you or doesn't give you any symptoms. You probably would go for your yearly medicals and then a doctor would pick it up and say, oh, Lexis, I think your prostate is a bit bigger than it ought to be. So we'd call this the macroscopic. And then we've got the clinical BPH. Clinical BPH. The clinical BPH, you have an enlargement and it is associated with what we call lower urinary tract symptoms. Lower urinary tract symptoms. And these symptoms are urgency, frequency, nocturia, intermittency, poor urine stream, incomplete emptying of the bladder, retention of urine, recurrent urinary tract infection, and hematuria, which is blood in the urine. I will take my time, would explain all of these things into great detail later on. Now, I'm sure somebody will be asking, Doc, you mentioned that this is the common disease of the prostate. Well, it is. So in terms of its prevalence, of all the diseases that affect the prostate, 80%, about 80% is because of BPH. Yes. And so an overwhelming number of prostate disease cases will end up being diagnosed as benign prostatic hyperplasia.
Yeah.
And then 20 or the remainder, maybe some 18% or so, or another number to prostate cancer, and then prostatitis will also take a very small percentage, about 2% or so. So overwhelmingly, it is BPH, benign prostatic hyperplasia. Right. There were autopsy studies that were done some time back, and you'd realize that BPH occurred in about 8% of men below 40 years. So Kwame tells you that it is very, very uncommon in men below 40. So I always say this, that when they say life begins at 40, Kwame, be that it's not true. That's where your wahala starts.
The trouble begins at 40.
Trouble begins at 40, you know, because before 40, more often than not, Charlie, you are fine.
Life is good.
Life is good, so you know, chill. It's just that in Ghana we don't have money before 40. So I am chilling.
When you have the money to chill, that's when hyperplasia and hypoplasia and one plasia will show up.
Exactly. You know, so it was only in about 8% of men below 40 who had BPH, and then about 50% of men between 57 and 60 years. All right, had BPH. And then 90% of men older than 80 years, 90% had BPH.
Wow.
So it tells you that you see this trend, increasing trend with age, you know. So we'll not say never below 40, but probably most doctors wouldn't screen you unless you have a family history of it before 40 years. And this is what we know from some autopsy studies that were conducted some time back. Right. Now, Kwame, let's jump into it and look at the clinical features of this BPH. How would I know? Or what are the early warning signs? What should make me suspicious to pay a visit to the doctor? And if I go to the doctor, what would the doctor even discuss with me? Well, Kwame, we would sort of like break the symptoms into 2 categories. We have what we call the irritative symptoms, and then we have the obstructive symptoms. But you usually will get a questionnaire, and we'll ask you in the past 1 month, how often have you experienced any of these things? The first one I want to talk about is incomplete emptying. Incomplete emptying. If you look at the anatomy of the human, there's the urinary bladder, which is in the pubic area, or we feel it in the pubic area. So anytime you have the urge to pass urine, that part of your body where you feel the urge, that's where your bladder is located. And as the bladder fills up with urine, it gets to a point you get the urge. So the bladder is a storehouse. And then once you get the urge and you go to void, you end up, you must end with a feeling of everything has come out. So if we ask you how often have you had the sensation of not emptying your bladder fully in the last 1 month, we don't expect you to answer many times. The best answer would be that, well, no, anytime I finish passing urine, I feel I have emptied my bladder. But if you don't, and you feel, it leaves you with a feeling that akakakra, there's something left behind, then we would give you a certain score depending on how often it has happened in a particular month. So that is what I mean by incomplete emptying of the bladder. The next thing is something we call frequency. How often have you had to urinate again less than 2 hours after you finished urinating? So, we don't expect that you would urinate more than once every 2 hours or less than 2 hours.
Okay.
So if you have to go within 2 hours after, urinating before, if we put everything together, we would say you are urinating too frequently. And that is what we mean by frequency. Right. So it is 2 hours, that 2 hour time limit. So we can all be checking that. The next one is something we call urgency. Urgency is about, are you able to postpone urination even if you have the urge to? So you are in here, and it was like, yes, when I was watching the Coco Golf demolish Sabalenka, I had the edge to go, but I was like, Charlie, when they've got into
you want to finish it.
I want to finish it. She should finish her and then let me go. 5-4, and then she wanted to do some shakarate first serve, then it went somewhere. Second, I was like, hey, no, she should finish the thing. So I could postpone the urge to urinate.
You should have postponed the one on the Yannick Sinner game. Kaboom.
So if you are not able to, even when there is the need, you are in the middle of something, but the moment you have the urge, you have to go, otherwise you risk soiling yourself, then we'll talk about urgency. Next is a weak stream. So there's an element of growing old here where what we call urodynamics are a bit different. But when we were younger, we'll stand and there's a competition. We'll line up. We'll see who has the most powerful urine stream. So the trajectory, you try and cheat by arcing the urine, so that it goes, it travels a longer distance. But as you grow older, you realize that because the urine is not traveling. So that's what we mean by the stream. If you feel that you have observed that your urine stream is very weak, literally it's sort of like dribbling in front of you, and you cannot shoot it, at any considerable distance, then it should be something that you want to talk to your doctor about. Another thing is straining. Watch him. You don't have to strain during urination. You don't have to. People think they have to. The moment you are straining during urination, it means your prostate is too large, it's getting bigger. Yes, it should come freely. When you unlock it with your mind, when you get there and you unzip and you are ready, it should just come. So the control is up here in your mind, and you say, oh no, I can't void now. Let me finish this game before I go. Let me finish this before I go. Then when you get there, then it must come.
Oh, okay.
But if you get there and you have to push the urine out, I think it's about time you go and see your doctor or talk to.
What about if you are giving it sounds? You know something? Oh, doctor, how are you laughing?
Even give me sound say.
Are
you a DJ?
No. No, you see.
Are you a DJ?
You know, sometimes the urination feeling, the feeling of relief is nice.
It's nice.
They give them some.
Give them some backing vocals.
Backing vocals. Well, as you, it's a good feeling.
It's a good feeling. Yo, if you say so, they have to also. Then the last point is nocturia. All right. How many times did you most typically get up to urinate from the time you went to bed until you got up in the morning? You know, so here we're talking about nighttime urination.
Okay.
All right. So for each of these questions, depending on the answer you provide, the maximum score there would be 5. And if you're answering yes to these things, then you're scoring higher and higher marks. Okay. And if we put everything together and you score above 18, then it will tell us that your prostate is most likely enlarged. All right. So these are very, very straightforward questions. And let me go over them quickly. Incomplete emptying, frequency, urgency, a weak stream, straining at urination, and then nighttime urination, nocturia.
Okay.
If you have any of these things, it could be so many other times. I think last week when we mentioned prostatitis, it came up. If we talk about cancer of the prostate, it will come up. There are other things, interstitial cystitis, other bladder conditions that can also give you these things. So it's not straightforward that these are BPA, but these are definitely symptoms that you need to talk to your doctor about.
Okay, great. But I'm sure after these questions, it's still not conclusive until some more investigations are done.
Absolutely. You know, so these will point your doctor in the right direction, say, okay, you know what, you need to investigate this person. So you get a complete physical examination. Because as I mentioned, this thing could be cancer of the prostate. So the doctor will give you a complete physical examination. But the primary focus of the examination is something we call the digital rectal examination. This is not AI stuff or anything. Nobody should. They hear digital and then they are thinking maybe we are using some AI technology. Nothing.
Yeah.
The digits. The finger. No, you see, that's why I say we shouldn't shake people's hands. So it was only COVID. So the doctor is going to perform an examination we call a digital rectal examination. And last week when I discussed the anatomy of the prostate, its location is such that we only get access to it through the rectum. Right. All right. So gloved hand, gel will position you in the knee to chest position on your left side, and then the doctor will gently go up your backside and then get to your prostate and then examine the prostate, touch it, and then try and get some assessment of how it feels like, the size of it, the surface. It gives us, some very, very useful information. It's discomforting, but it is not painful. I mean, if the doctor also has the expertise in doing it and doing it gently. Beyond that, we'll also run some lab tests. Particularly, we are interested in a urine sample. We'll do a blood test for kidney function test. But last week, I also mentioned something, the PSA. All right? The PSA is also a very important chemical, if you like, that comes from the prostate cells only, all right, in your blood. Typically, the level should not be beyond a certain number, 4. If it goes beyond 4, then we begin to have our suspicions about it being enlarged. So the higher your number for the PSA, the more likely that there is something, or the number of cells have increased, so they become more. You also get a scan, an ultrasound scan of the prostate as a first step. Your doctor subsequently may ask for an MRI scan or even a CT scan, to better evaluate it. And then also do a prostate biopsy. So once we get a sense that your prostate is enlarged, we need to take a little bit of it and send it to the pathologist, the anatomic pathologist, Professor Akosa and his team, of experts, to examine it microscopically
Okay.
and give us a name.
Yeah.
So they actually name it. So that's a sequence of things. You may end up with a prostate biopsy. Then we get to know. If the report comes back and it says benign prostatic hyperplasia, we are relatively happier than if it says carcinoma of the prostate.
Okay.
All right. Both we can have interventions. However, I'll be relieved if it is a BPH. Now, quite there are some complications. BPH can be bothersome. As I mentioned, it probably won't kill you as prostate cancer does, but you may have some complications. Do you know Shamoba?
No.
Brain Philip here. He labadi person. You should come and explain Shamoba. He knows. He knows Shamoba.
Philip.
Right.
Philip.
There's retention of.
We need you here.
Labadi man. We need you. Shamoba.
Shamoba. That's what I mean. Wee is not coming.
Exactly.
How do you know this?
I don't know why the Ga expression of it has stuck, and a lot of people call it by that.
Okay.
But that's retention of urine, and I got it in med school, and it's sort of like everybody refers to. So when the prostate gets so enlarged, it could totally block urine flow, such that you are not able to bring any urine out. And Kwame, I have seen men cry like babies because of that.
Wow.
And then you have recurrent urinary tract infections. Because the urine is staying in one place, germs grow out of it, and the infections can track up to the kidney and give you problems. You can also have bladder stones, and then generally it can affect a man's quality of life. So
Who actually thought that urinating is a blessing?
Yeah, it is. Being able to.
Yeah, being able to.
Some of the things, that's why I say you should count your blessings, and thank God every day. But we just pee freely and then complain about E levy and D levy. Anyway. Well, so Kwame, there are some treatment options for BPH. It's one of those things that we can confidently handle.
Okay.
All right. So no problems at all if you have it. It can easily be dealt with. I mean, we've got experience over the years in Ghana and in most places to deal with BPH. Sometimes we do nothing. We do something we call watchful waiting.
Okay.
Yeah. Because we'll think, okay, corner bra, like in 2 years or something, would follow you up, 6 months would follow you up. So there's that option. Or there are some medical therapy, including phytotherapy, plant therapy. All right. We'll give you some medicines and then we'll ask you to go and come back. Or you will do some minimally invasive procedures like laser. You can also have surgery.
Wow. Charlie, there's so many. Wow. It's interesting, eh?
Yep.
If you wake up and you don't visit a hospital, it's a blessing. Well,
it is.
Doc will not make money, but yeah. But it's a blessing.
We can come for general screening. We want to make money for general screening.
From general, because.
Yeah, but I understand what you're saying.
I'm just following and realizing that even being able to pass urine, is a blessing. If you wake up one day and you're unable to.
One day you're unable to, and it's excruciatingly painful not being able to pass urine.
Well, I'm sure sadly some of our friends would suffer these and would need your help. So how do they reach out to you?
Right. So if you're a man above 40, just give us a call. Come in and let us do your prostate check as part of your Father's Day thing. The number is 0501 477 340. We are on WhatsApp 0501 477 340. And come and meet our team at the Urology Center at Medical's Hospital, number 10 Kincho Street, East Legon Hills branch. And we will be able to assist you go through this.
Great. Dr. Osafo, thank you. Thank you so much. Every day I thank God for your life, because some of the things that you educate us on and we get to know. People are probably just going about their day thinking, oh, life is normal, I'm fine. Hey, I don't fall sick, I'm good. Yeah. But you actually remind us every Wednesday that we are blessed if you are not sick.
Right.
So thank you very, very much to you and your team at Medical's Hospital. So if you're listening in and you need help or you need a doctor to clarify anything, you need medical assistance, the team at Medicas Hospital is your best bet, okay? They're right here in Accra. If you just go to East Legon Hills, they're about, you see a very lovely facility, and Dr. Osafo will be there to see you.
Absolutely.
And please, if you see him anytime soon, just wish him well, and Yannick Sinner.
Speedy recovery.
Speedy recovery. He's managing grief.
We'll see you, Wimbledon.
And this grief was one of probably the most painful ones ever, especially when you are just this close to winning it, and then this devil of an Alcaraz will show
Guy
you
is
Pepe.
too good.
Alcaraz is just too good.
It's too good.
And when guys, let me tell the story, because it looks like our news people they're on vacation.
Maybe you have connected with the news people to tell this story.
So, Dr. Osafo and I were watching the tennis match over the weekend. He was at home, and I was at home as well. So, Yannick Sinner wins first set, and he texts me laughing emojis. Ha, ha, ha. We are beating you people today. He's going on and on. Then second set, they win it. Ha, ha, ha. He's dancing, sending me stickers.
Charlie.
I told him that, listen, this is tennis. It is not over until it's over. They say the rest is history.
Me, and if you got to relax, prepare something to celebrate, put in some wine, red wine in the fridge.
Hey!
Oh, sorry, because Sinner had put me in some great mood after 2 sets. I was like, oh, no, there's no way anybody can come from two sets down.
And even a breakdown
Against
Yannick Sinner.
It's not. This is not like maybe some Oda Djokovic or something. This is Sinner. So I have my hashtag. I'm a sinner, banner up and all of that. Feeling good. Hey, then
before
I
you
see.
realized,
Guy said, "Jama is sending me some jumpy emoji." That's But this guy, if you know you can't do that thing, why do you go and raise our hopes?
anyway, Doc, thank you so much.
It's good to be here.
Do have a good week, okay?
Sure.
All right. Stay tuned in to Joy 99.7 FM.
Afternoon.
Oh, afternoon.
Please, Momo.
Deposit or withdrawal?
Withdrawal.
I like